Well, good morning, everyone. Welcome to our webinar series. My name is Crispin, Operations Director at Civil Service College. I am facilitating today's webinar. Civil Service College webinars aim to connect public sector colleagues in the UK and abroad with our expert trainers. Our webinars look at topical issues and its application with real-life examples. If today is your first time joining our webinar series, you are very welcome, and I hope you will like it. For our alumni, welcome back. Let me first start off with a very brief introduction to Civil Service College. We are an independent training organisation that offers training solutions to the UK civil service and the wider public sector. As you can see from this slide, sorry, let me just move back. It went to the world map for some reason. As you can see from this slide that we deliver training not just to the UK central government departments, but also to the devolved administrations in Wales, Scotland, and Northern Ireland. And of course, we deliver training to our NHS as well as our local authorities. We also work with governments across the world. As you can see, our presence range from the Far East to Africa, to also in Canada as well. And today, we're very pleased to have overseas civil servants joining us in this webinar. We conduct over 70 courses over 7 key categories, as you can just see from this slide, slowly coming up. And today in the procurement topic, we do some courses under the finance and commercial category. So if you are interested after this webinar, feel free to drop me an email so I can tell you a bit more about any of our courses that we have. You can either join one of our open courses that we have currently have on our website. We have training days up to the end of 2021. Hopefully by next year, we can resume some face-to-face training, fingers crossed. In the meantime, you're all welcome to join our virtual training. But if you want our training to be more tailored to your team, we understand your requirements, make sure the training materials reflect your your contacts, Maurice will be more than happy to do so. And for our international audience, Maurice can deliver training to you over Zoom or Teams, or when travel permits, you can fly out and deliver the training in person. And in fact, before the whole lockdown, it's very hard to keep track of Maurice because he's always flying out to different countries to deliver training. And in fact, aren't you, Maurice, planning to go to Dubai to deliver training?
That's correct.
Great. But stay safe.
Thank you.
Just before we start, allow me to cover a few housekeeping notes. Today's webinar is being recorded. I apologize that we have to switch from Teams to Zoom at the very last minute. We've been trying now to get some of the features in Teams live events work yesterday for the whole day. Maurice and I have been trying to get it, but somehow it's just not working, and we suspect that this related to the Microsoft global outage happened, I think, just a couple of days ago. So for your colleagues who are unable to join us this morning, please feel free to contact me, and I will send them the recording after this webinar. Another housekeeping note, if you have a question for us, whether it's a tech issues or regarding this subject area, please use the Q&A function at the bottom of your screen. We were trying to keep this webinar as interactive as possible, so please do share your thoughts in the chat box. And if you're happy to share your thoughts with everyone, please have your message sent to all panelists and attendees. Otherwise, only Maurice and myself can see your message. We were trying to address your questions during the presentation, but if we can't, don't worry, we have some time at the end for Q&A. So today, just gone a bit fast again. Today, our title is Best Practice in Procurement in an Emergency. We're very pleased to have our expert trainer, Maurice Diamond, with us. Maurice is a senior executive and qualified public accountant from a management consulting background with significant operational management and business development experience in the UK in the business improvement and international development. There's so much information about Maurice on this slide, so if you want to, you can read it, but I was trying to summarize as much as I can. Maurice has a significant experience managing revenue and capital budgets in both in the local authority accountant and as an interim finance director for public sector organizations. He received 3 prestigious awards for excellence in procurement, including a Gold Award for Innovation for the Medicines Control Agency. He has a reputation for delivering on time and budget and ensuring stakeholder engagement whilst building local capacity. So Maurice, could you please tell us more about best practices you have seen during this pandemic and whether we are actually still in an emergency?
Okay. So yes, first of all, good morning, everybody, and thank you, Chris, for the introduction. So yeah, interesting question. Are we actually in an emergency in terms of procurement? And what is that best practice? Now, today, I'm focusing on examples that are more UK based. I don't apologize for that because I'm going to offend people from outside the UK far less by doing that. Although I have done a similar seminar where we've talked about different experiences in about 21 different countries. So we brought that learning together today. So what are we going to look at? Well, first of all, is that definition of national emergencies and procurement. Then we are going to use the COVID-19 experience, and you'll all be nodding your heads as we go through the material. Then we need to understand the timeline for an emergency. And I'm actually going to use a Deloitte model that they have created to take us through that, and also to modify that model. Then we're going to look at that best practice advice, and then finally look at the World Bank procurement and economic support that's available. So that first part, the national emergencies. So what do we typically see in any national emergency? Well, panic and rogue buying, delays and closure of borders, reduced staffing through sickness and lockdown, export prohibitions and restrictions on essential goods, disruption of supply chains, economic disruption, and sadly also, but not unsurprisingly, civil disorder and disobedience. And that's par for the course. Also, you need to consider the economic impact in general. So if we were forecasting an economy to grow, it's likely that it will start to shrink. Unemployment will grow significantly, businesses will fail, they will disrupt supply chains. But having said that, we're going to get some sectors and businesses that will prosper, who can take advantages of the actual circumstances we're in. But typically, there's a potential long-term structural change in the economic activity of any country. Now, remember, a national emergency could be anything. It could be an earthquake, flood, pandemic, anything at all. And therefore, the consequences are going to be different in different scenarios. But what is the role of a government during an emergency? Now, obviously, whatever that scenario might be, we would expect the following. The government to help to secure access to food and other essential supplies, to prevent the rogue and panic buying, to control and limit price increases, secure or even create supply chains, work with suppliers on a partnering basis, and also get those supplies at an appropriate quality as well. Promoting businesses to look at different ways that they could help to contribute to the situation. So moving over from, let's say, making dresses to making masks. Then enabling and supporting that continuing economic activity. And then finally, obviously, trying to maintain civil order. So we see a variety of different tools that government can use to achieve compliance during a national emergency. Certainly in the UK, the initial approaches are always softly, advice, logical argument, then persuasion, then regulation. If these things aren't working, effectively, it moves to legal constraints, potentially a state of emergency. Now, why am I mentioning this? Well, this is fine, but you can only enforce something if there's an ability for people to respond. So you can only enforce the wearing of masks when there's sufficient supply. So consequently, the way that government behaves also depends on where it is in a cycle. And if there are only a small supply of masks, how are we going to prioritize the use of the masks that we have? So we appear over the period to be changing our advice, but actually we're doing it because of the availability of resources. And availability of resources is all about procuring and getting sufficient at the right quantity and quality. So most countries have public procurement legislation. The United Kingdom as a whole, including all of the 4 nations, is still covered by the EU rules. And we have a variety of different approaches that we could use normally. The problem with each of these is that although they are designed to deliver an effective and transparent procurement, they have time periods built into them. In an emergency, we're not going to have time to deal with those time constraints, those delays. So we need to do something a little bit different. So how are we going to do this? So we normally have associated legislation or regulations, depending on the countries that we live in, that needs to define an emergency. So how can we actually not have to follow so much these standard approaches in order to get what we need straight away? So under what circumstances will the emergency regulations, rules and procedures apply? So in the following circumstances, buyers may be required to directly negotiate and purchase from suppliers that have capacity, and typically described as direct awards. Now, obviously, there are thresholds. So if you're above the thresholds, for example, for EU, for purchasing, you then would align with those EU rules. For anything that's below those thresholds, then it's up to the national governments to absolutely decide how those items could be procured. But if there is no time to run either a traditional competitive tender or fast-track simplified competitive procedures due to the urgency of the needs covered, or where there has been a limited pool of suppliers with delivery capacity, and there's only maybe one supplier with capacity to deliver the required product, then we then can move to a direct award situation. So whilst procurement rules normally discourage direct awards, they may be necessary in cases of the emergency or the force majeure. Or although, remember, the OECD will always remind us that in normal circumstances, we should be opting for competitive tendering to get the best price, quality, and goods. So now let's look in a bit more detail about that COVID-19 experience. So remember that in 2003, there was an outbreak of SARS, and everybody thought that it was going to be horrendous, it's extremely dangerous, and everybody's going to die. But then it just disappeared. In 2009, we had swine flu, or bird flu, and in the United Kingdom, millions of doses of something called Tamiflu were ordered and delivered, because yet again, the view was the whole country would be overrun. But actually, when people got it, the actual swine flu, actually it was not so serious. So something had happened. So our experience of pandemics in recent years has been that they come and they go, and they've not actually had the impact that COVID-19 has had. And it's very interesting because an epidemic refers to an increasing trend in the spread of a disease within a specific community. But the World Health Organization defines a pandemic as a global spread of a new disease, though the specific threshold for meeting that criteria is considered to be a little bit fuzzy. But in January, WHO described COVID as a public health emergency of international concern. It wasn't until March the 11th that it was declared a pandemic. By that time, there are 118,000 cases in over 110 countries around the world, and there was this sustained risk of further global threat. The response in the UK was on March the 23rd, lockdown commenced. Stay at home, work from home if possible, only leave home for essential purposes, food and medicine, exercise once a day, caring for a vulnerable person. By that time, the shops were already empty. All the toilet rolls had been bought that you could possibly find. All the food that you could think of had been removed from the shelves of the supermarkets. So the lack of contingency planning led to an acute shortage of essential supplies. So it had a direct impact in some cases on prices for essential goods and services. I might make you laugh, but it appears that toilet rolls were indeed essential goods and services. The price went up. Market availability and quality concerns. There were those broken and restricted supply chains. We heard about delays getting into the supermarkets. There was food sitting in warehouses. There was a need for drivers. And the normal coordination between agencies, implementation units, and project teams in government was becoming very, very difficult because people were ill. People were at home. And the technology had not yet got into the homes for people to do that home working. So many contracts were delayed or terminated. They were unable to fulfill their contracts because of excess demands, quality concerns, that self-isolation, unpaid bills, significant issues with cash flow, broken supply chains, and indeed border crossings being closed. Then you had that unprecedented and competing demand for PPP and other products within a short time scale, resulting in changed behaviors from existing suppliers, demands for advance payment to secure supplies, increased risk of fraud and insufficient by new and existing suppliers and service providers. And generally throughout the world, the experience is that if you relax the procurement rules, and particularly during an emergency, you're going to find a lot of misprocurement, a lot of fraud. So the UK response, as with many other countries, the correct response and the best practice response is to issue procurement policy notes. Now, I've identified here those that were issued from Westminster, and at the end you'll see the Scottish version, which is the SPPPN. So if you want to look at the equivalent number for Scotland, then please look below. Wales tended to adopt the UK or the Westminster notes that are there. So what you'll see is this. First of all, there was the first note was to procure under emergency regulations. The second one was actually about protecting the suppliers, even going so far as to say, if your supplier is having problems and they may not be able to fulfill the contract, consider continuing to pay them for at least another 3 months. We're looking to the future. We're trying to look at the period beyond the pandemic. We need our suppliers to be in place. Then the government talked about central government using procurement cards more widely, increasing the levels that could be spent against those cards. Again, this was to help the suppliers to get them their income as soon as they could. And what we then got, when the 9th of June, and there have been updates to each of these since they were originally published, recovery and transition from COVID-19. So it was acknowledging that actually the outbreak is not short term, and therefore we need to start working back to a new norm. I don't like to say it, but that new normal. And we're going to come back to that in a minute. So example of actual practice, ironically, has been competing on the open market to secure supply, pushing prices up, letting contracts directly with untried and untested suppliers. So with the Ebola crisis, the UK government used the Crown Agents, a well-known procurement organisation, to set up very rapidly 6 hospitals very effectively in Sierra Leone that were then run by NGOs. And it was an absolute success, worked very well. Or you could let contracts to an investment company for PPE. I leave it to you to think about that. Clearly, we were securing supplies of insufficient quality. And of course, a lot of countries were banning exports of essential supplies because most countries want any supplies that are available to be available internally. Now, latterly we heard of this company, Ianta, who have been accused of providing face masks that were of insufficient quality, 150 million pounds worth. The contract was 250 million, so therefore there's another 100 million of the contract that was clearly okay. And I should point out that IANDA actually are fighting this particular issue. They believe that the quality of the goods was in order. But you know, the company is an investment company owned by a particular company based in Mauritius and so on and so forth. And its expertise is offshore property and private finance. I'm not saying it's something we shouldn't do, but in an emergency, one of the things you really shouldn't do is get on Amazon and buy the thing that looks like it's what you need. And then when you get it 2 days later, you have to send it back. Better to check what you're buying first of all is appropriate and then purchase it. So we've had lots of criticism, as you know, the 400,000 Turkish gowns that were delayed, that went off somewhere else. Then we had the dosages that were not apparently there to supply Wales. We had the face masks in Scotland that the nurses were complaining about. And also there have been accusations that companies have been brought in to help the government and their processes have not actually been particularly helpful. I'm not suggesting that that is the case, just these are the typical headlines. The OECD did a stock-taking report, and it states that the public procurement, of course, is at the front line of many countries' response to the crisis. Countries generally use their established frameworks for emergency contracting. Centralized and coordinated approaches are being used on supranational, national and regional levels. Public buyers are engaging with suppliers more often, and emphasis has been on improved transparency and accountability. And the preliminary lessons suggest we need to rethink risk and contract management frameworks. But the OECD does remind us that it's actually really important to be vigilant and monitor suspicious selling patterns in emergency procurements. If somebody offers you what you want, then you need to check to make sure that it's genuine. So now let's just quick look at that timeline. So Deloitte's produced this. It's in their magazine, Deloitte's Insights, and it's referred to on the internet. Now they came up with something which was Respond, Recover, Thrive, and actually we're about 6 months into that now, where I've put the red line. I actually and I know Deloitte's, this is a great thing. I'm not complaining about this, but I think that we need to add a couple more things into this. So Deloitte's are looking at separately the health issues, the economic issues, and then the business of government. And what I want to do is to add recognize and stabilize, very much actually like if you go to the doctor or a hospital with an illness. First of all, you need to understand, diagnose the issue. Then you need to respond to it, stabilize it. Then there's a recovery phase. And then maybe afterwards there's some lessons learned or some ongoing support, whatever that might be, but we thrive. So that's how I look at this, and I hope everybody can understand that this is just adding to the Deloitte model. Hopefully anyone from Deloitte, I hope you think this is a positive. Why is it important? Because during each of these phases, we need to actually undertake different things. Now, I've not completely rewritten this. I've simply adapted it for today, but it takes us through those 5 stages. And what's important to me is that regardless of whether it's health or the economy or the business of government, each of them involves procurement. And therefore, procurement runs through the whole thread of what's happening at the moment. The question is it all in an emergency? Or is the pandemic an emergency and the procurement response is initially an emergency? So let's just quickly mention that recover. So there is this need to obviously go back to the workplace, and it will involve physical and digital infrastructure and to get also financial assistance for businesses and local government. And there'll be other challenges involving different stimulus. We'll come back to some of that later on. So we have these competing demands. We have health, we have the economy. And the need to understand this, that pandemic state, and potentially manage failure is not getting it right. It's very difficult to get it right. There's no experience. limited experience in globally for this sort of thing. Hopefully, the future state, that wished for success, is that equilibrium that I'm showing there. I'm not suggesting we're moving down one direction or another, but we need to take care in what we're doing, and there is a very difficult balance to be taken, which will be reflected in our procurement. So let's look at that best practice advice. So best practice allows those direct awards under certain circumstances. There have to be genuine reasons for extreme emergency. They need to be unforeseeable. So for example, Brexit, and having an emergency needing to buy something because of Brexit would not be perceived actually to be an emergency. So contracting for somebody to run a ferry port or to move containers from the UK to another country would not be under an emergency. You can't make your own emergency. But it could be that it's impossible to comply with the usual timescales, and therefore, and there's no time to run the accelerated procurement or indeed use an existing commercial agreement. But remember, the situation can't be attributable to the contracting authority. Okay. And what should you do? Well, if you go down this route, you need to keep a written justification of the need for the direct award, because it's likely in many countries that there will be a legal challenge, but there'll certainly be an audit. Limit purchases to only what's absolutely necessary in terms of volume and length of contract. Use good commercial judgment during any direct awards. If prices are higher than in a regular market, ensure that mechanisms enable future pricing reductions to be secured. And we're seeing examples where there has been overpayments being made. The examples are in all around Europe and the US, but also Indonesia, Brazil, Thailand, Kenya, and South Africa, as well as Ecuador and Paraguay. Continually assess whether the emergency conditions are still met before conducting subsequent or additional procurements. But remember, use or return to normal procurement when possible. Now, the other thing is you need to publish the contract award with so many days from the award. So if you're a country like the Ukraine, if you let one of these contracts, you need to actually register it within 1 day. That's the way that they're trying to enforce transparency. In the United Kingdom and other countries, it's 30 days. So what is that period of emergency? In my view, we only had that potential emergency, or that emergency procurement should happen during that response or act phase. So recognize or identify, respond and act. That is the only point. We didn't have face masks, we didn't have PPE. The view now is that we've got insufficient respirators, ventilators, we've got PPE for at least 4 months. So we now can go back to normalizing our procurement for those particular materials and goods. So issues specify, basically you need to follow national and international rules around emergencies and pandemics. You need to issue specific procurement notices, where possible work with known and reliable suppliers, responds to the need of the urgency, but still use standard best practice. Any direct awards should be gradually abandoned, moving back to more competitive solutions. Use and share existing frameworks, work constructively with the market and suppliers, and communicate carefully with the supply base. In the longer term, consider adoption of technology. E-procurement is a big thing now. A lot of countries, a lot of authorities have indeed already adopted e-procurement. It's extremely helpful if you're using e-procurement during an emergency. And also promote intergovernmental collaboration and centralize purchasing to secure economies of scale and share knowledge and experience of framework contracts. So there are distinct benefits around sharing, around having a shared collaborative service model. It provides improved knowledge of the market and suppliers at all times, and also a better understanding of overall demand as a customer. This isn't about actually a centralized model. This is a shared collaborative service model. Benefits-driven approach. It has an improved service culture. It should have an efficient delivery model. Should be using leading practices. Be metric-driven. needs to be an independent entity within the organization, and it needs to have appropriate infrastructure. And this should lead to better outcomes at all times. Now let's look at the micro level. So now, before we were looking at the environment, now I'm going to look at the contracts themselves. So check whether existing contracts can be renewed or extended before a direct award. Any renewal or extension should be limited in time and scope to respond specifically to the emergency situation. Consider allowing contracted supplies to exceed previously negotiated maximum quantities, but needs to be controlled. Review, identify, and assess equipment requirements, needs, and risks. Undertake virtual procurement briefing sessions. Don't just ignore the need to brief suppliers. Streamline and simplify processes. We don't want duplication. There's no point buying stuff, having it delivered, and then there are delays in the authorizations. But you need to, when you get the stuff, confirm the specification, test and inspect for quality, maintain and nurture supplier relationships, and if necessary, use stage payments and enable and facilitate prompt payment and early payment. And document the procurement processes, the reasoning and the decision making. So let's just look at that in a little bit more detail. Normally we have to write a business case. Now, it would be ridiculous to go through the whole process of writing a business case. It could take some considerable time. It doesn't mean that we shouldn't be writing at least a business justification. So over on the left-hand side of the slide, we can see what the purpose of a business case is and what the basic structure should be. Now, our emergency procurement justification needs to cover the things that are down on the right-hand side. We need to go back to this later on. This is a document that says why we need, what we're buying, at what quantity, and when. It needs to include the key risks. Now, this has to be put together very quickly, and it shouldn't be a long document, but we still need it. It's extremely important. Many suppliers in many countries are quite litigious, and if they believe that there is a problem with the nature of the award, then they will complain. And also the auditors will want to make sure everything is running smoothly. In the United Kingdom, we've had a review of the expenditure on ventilators and respirators. And although we've spent much more than we would have done in the past, the view is that because we were in an emergency, it was reasonable because it was about saving lives, but it was also well documented. You may remember there was a government challenge about making these, and F1, Formula One racing companies started to, in fact, produce these things. Whether or not they were any good, it's almost less important than the fact they were seen to respond, and we saw these partnering behaviors. So, OECD best practice advice. Where possible, use pre-emergency market intelligence to inform decisions that we're going to make during this time, including procurement data on pricing, suppliers, capabilities. Pool forces and conduct joint procurements to attract suppliers, economies of scale. Phase out those direct award procedures, remember that. And public authorities should identify and evaluate new ways of working and streamline, modernize, and implement e-procurement systems where they can. So the following still applies during an emergency. Right product, right quality, right quantity, right time. Delivered to the right place. Remember the care homes and the issue about the care homes. Right supplier and get that right relationship. Unless we get these right, we can't achieve our procurement objective. We may have loads of gowns, we may have loads of masks, but we can't use them. So our key workers would still be unprotected. If during the earthquakes in Pakistan, the UK had supplied bridges which were not suitable, then what would they have supplied at all? Nothing. So you need to think strategically. Write up the story that's actually written up in advance as your business case, but what was the experience? If it was positive, make sure we know, get it on the system. Maintain the documentation. Share learning and experience. Maintain emergency risk scenarios. In the UK, we used to have strategic supplies of goods and so on, where we made sure we grew things in the UK. we produced things in the UK, we manufactured things in the UK. But after the Cold War, and I'm obviously old enough to remember that far back, we stopped thinking in that way. So, but actually, this pandemic doesn't mean to say we should be filling warehouses full of goods, but it does mean it's about understanding what what we can order and what we can receive in what timescales at any particular point in time. We need to understand the wider market. We live in a global market, and we need to keep up to date. And again, I apologize to Deloitte before I apologize to the scouting movement. The important thing here is be prepared. So just want to finish on a wider note. So in April 2020, the World Bank launched the Fast Track COVID-19 facility. It offered help with supplier identification, support for bidding and selection, negotiations to contract signing, and also a monitoring of implementation as well. So a lot of good stuff there for any of you who are sitting in countries where you feel you needed to get some additional support. This was what was available, and also through the more localized multilateral development banks. Over the next year, the World Bank Group will be providing up to $160 billion in financing. The IFC is deploying $8 billion in fast-track financing with, well, this is probably older now, but 300 companies were requesting support. And then the Multilateral Investment Guarantee Agency has a goal to promote foreign and direct investment into developing countries, and it's launched a $6.5 billion facility to support private sector investors and lenders in tackling the pandemic. Now, just want to mention one more thing. Phrase of the moment, shovel-ready schemes. In any country you're in, you'll hear your prime minister, your president talking about shovel-ready schemes. We're not going to talk about that now. So I'd just like to say thank you for listening. I hope that you have enjoyed the material we've been through. And now I think it's time for questions.
Yep. Thank you very much, Maurice. I think there's quite a lot of information for people to absorb. Don't worry, I will more than happy to share the last slides after this webinar. Some delegates already sent in their questions, so if you have any questions for Maurice, please use either the Q&A function or the chat function. Should appear at the panel at the end, at the bottom of your screen, and just put it in there, and then I will ask Maurice as we continue with this webinar. So Maurice, our first question, someone asked, how can we ensure transparency in the tender award or the quality of the goods services in an emergency? I think you briefly touched on this in your presentation. Can you elaborate a bit more in this?
Yes. So what we should be looking for is that business justification. So the first thing we need to do is to say why we need something. So there's that usual business need, and that business need needs to be specified in terms of quality, quantity, and so on. Then we need to, if we're going to a direct award, we need to briefly explain why we're having to go to that direct award, and then the nature of the company that we're going to and why it can fulfill our requirement. Mm-hmm. Now that's going to be absolutely key, because there are lots of articles on the internet about companies who won awards this year in the United Kingdom, and guess what? The owner of the company was a friend of a cabinet minister. Mm-hmm. Now, of course, any company can have friends who are cabinet ministers, but if that is the case, you want to make sure that whoever is procuring with you, if you're the company, shows that it's a watertight reason for working with you. Now that needs to be documented, it needs to be available, and at a future date, whenever, it needs to be audited. I think that probably covers that. That's the transparency.
Yes, I think that the important thing is able to stand up for challenge or any kind of challenges that you might face in the future.
Yeah.
And can I also go back to your reference to Deloitte's model when you talked about we are currently in a stabilized, maintained stage. Do you
Yeah.
see with the second wave coming that we will return to the emergency stage again, where because the model is very linear, where it says stabilize and then the next phase is recover, but is that the model allows you to be more like a cycle, perhaps back to the first phase, where it's about recognizing the whole situation that it is an emergency, then you really need to respond swiftly.
Yeah. You could, I mean, obviously it's not, it is the Deloitte model. But what I could say is you could imagine it as a spiral going round, in which case it might link back in again with a second wave. But let's look at it slightly differently for the moment. We had that ACT phase. So we've identified, we've diagnosed the problem. We are now going to have to act upon it. And what we've done here with procurement is the phase which is associated with that emergency procurement is in fact that phase. Because now what we've done is we've moved out of that, only because we are now being told that we've got warehouses with 4 months supply of PPE. Yeah. Mm-hmm. So yes, there might be a second wave, but will that we can still maintain that? Yeah, the current situation, if you're with me. So the second wave, the number of incidents of COVID can increase dramatically, but actually it's under control, if you're with me. And now it's under control because we have methods of dealing with it. We have enough respirators, we have ventilators, we have all of that equipment. So in that respect, we're in to maintain for the purposes of procurement. But I do understand what you're saying, absolutely. And of course, it could be so bad that we would then run out of all that PPE again. Then obviously we would actually be back into a new ACT. But that's not necessarily linked to a second wave of COVID.
I see. Thank you. And as you said, I think for procurement specialists who recognize the different stages and able to maintain the best practice, but how could they communicate to non-procurement colleagues that we are not in an emergency, we can't do direct tender anymore?
Yeah.
What advice would you give to procurement colleagues?
Yeah. So very good question. Obviously, if you're a procurement specialist, you have your professional pride. Yeah. So one of the things that you're going to do is be able to say, you know what? We may be in a pandemic, but I already have in place all my contracts and all my orders to deliver exactly what you need. So you don't need to rush out and, buy something on Amazon. We all work in organizations where we have to use central purchasing. I'm going to use that term. For example, for the printer that we have sitting next to us. And when that printer breaks down, you phone up IT and they say to you, yes, we'll sort it out. We'll be around in a week. I'm just trying to make it sound really bad. So what do? You, as I said earlier, you get onto Amazon, don't you? Or you nip out to somebody like Currys and you buy one in the interim. When you get it back, you realize that it doesn't do photocopying. It doesn't do scanning. It doesn't do what you need. So you still have to wait that week. So we're always, as users, always wanting things now. We want things immediately. We want things, as people say, yesterday. Actually, our procurement department may have the contracts already in place to deliver these things. And it's just a matter of drawing down on that effectively. So there is a discussion to be had, but there needs to be an interplay, understanding the difference between having a contract in place, having sufficient supply, and maybe a warehouse, and I'm going to use the printer example, and the actual ability of somebody to bring it from the warehouse to you, if you're with me. Yes. So what our issue is actually having more installation and more desk support. If you see what I mean, it's a slightly different end of the argument.
Yes. Thank you, Maurice. I mean, in some of the contracts now where payments is required in advance, how would you advise procurement specialists to ensure delivery, contracts are managed properly to make sure the suppliers do deliver?
Yeah. So the interesting thing is that the rules. There's an interesting question here because it's talking about paying in advance and how to ensure delivery. Now, this is all covered in the procurement notices, actually, and I'm just going to find if people are interested, it's the frequently asked questions PPN 0220. Okay, so it's a second procurement notice for this year, and it says here, right, question 5. A supplier is unable, you see, I'm very well organized here. A supplier is unable to continue fully delivering their contract due to the COVID-19 outbreak. Does the contracting authority still pay them? And the answer is, now remember, this is the Cabinet Office answer. If the contracting authority has determined that the supplier is at risk, then they should continue to pay them as normal for the next 3 months, even if they are not able to fulfill all their contractual requirements. If the supplier is able to continue delivering their contract as normal, then the contracting authority should pay them as normal. Now, I know that doesn't absolutely answer the question, but it does show you that what's going on in that particular circumstance is the government's trying to protect ultimately the supply chain. We must remember that as companies have failed and dropped out of the supply chain, they've not been paying people who otherwise would have had the ability to produce goods or to deliver them or what have you. So by doing this, there is very quietly in the background, there is that stimulus to these suppliers. There is that help that's going on. We don't hear about it, but it's there, and obviously has to be considered very, very carefully.
Thank you, Maurice. One of our attendees have asked, what about the issues like ramping up testing capacity, which is not yet under control? What is your view on the procurement on that?
Right. What's my view on it? Okay. So the issue really is around having the right. Now there are a number of different suppliers and people out there who can provide us with these tests, and the problem is that the way that they've been organized is to bring multiple organizations together, be it labs, the army, locations, and that all has to be managed and have managed effectively. Then we have the different nations wanting to do things locally and to kind of put their print, their mark on what they're doing. So that's an extra level. So you've got, rather than streamlining, which is what I was talking about before, I think that the procurement of testing and tests and so on is becoming a difficult issue because there are so many layers of involvement. And I'm going to say something that might be controversial, but I've noticed on the news channels that rather than being supportive of what we're trying to do, the focus is on the negative side of it and pointing out things that are not working properly. Now, I think that's okay, that's fine, because it's only by knowing that we know how to deal with them. But it's then causing the government to look at responding to the criticism to the public rather than responding to the situation on the ground. So I think you've got all these multiple layers that are coming in, which is creating a difficulty. Now, you mentioned, in fact, that I'm going to Dubai to deliver a course in a couple of weeks. And I've got to have a COVID-19 test before I fly. And it's quite simple. I get on the phone, I phone up the doctor who has a lot of these tests, and I pay £150 for the privilege. And it's in London, it's great. And of course, within 2 or 3 days, they guarantee the response. Well, it just shows you there's always an alternative. But that, I don't believe, is the right solution for all of us in the UK. It's a bit like it's a private medical solution rather than the public. So yes, of course, there is a need to consider how more that we can deal with these things. But remember, however much we're being told, we're also not being told certain things. Because if you tell the public everything, then we panic. And in an emergency, they don't want us to panic. And right at the beginning, I don't know whether you remember this, but I just came back from Canada and I was in Toronto and I went to the airport. There was nobody on the roads, nobody in the airport. Security were not even there. I thought I'd gone through the wrong channel. Got on the plane, 35 seats around me, nobody. Got home, and during the following week, the Boris Johnson each day told us, oh, we might be going to do this, we might be going to do that. What I believe he was doing was getting the public ready in the United Kingdom for the lockdown that happened the following Monday. He was preparing us by each day telling us something more so that it didn't come as a shock. Because the one thing in Britain we always complain about is that kind of literally the lockdown. And even now, when it happens in a particular area, everybody says, why can't you give us notice? Obviously, it's counterintuitive because you lock down when the issue occurs. But anyway, I just think that that's just an important issue.
Yeah, that is a very good observation. And in fact, in the UK, it has always been a very gradual process rather than an immediate implementation, where we have seen in some Asian countries where it's people have less than 24 hours to be ready for the total lockdown. And it's quite a shock to cause a lot of panics as well. But we won't go into further into that issue.
Well, we all had to buy our toilet rolls, didn't we?
Correct, yes.
The Wednesday before lockdown, so in that week when I came back, my daughter was at university. And my wife and I decided to get her, we were going to get her on the Friday because things were clearly moving along. And I remember my wife and I had a conversation and we said, no, we'll get her Wednesday. We'll get her, which was that the next day that we were talking on the Tuesday. Because I said, things are moving quickly. We need to get her. So that Wednesday, we went up to Oxford and we collected her. And on the way back, I went into a Sainsbury's supermarket. There wasn't a thing in the supermarket at all. Now, that obviously that wasn't a good situation, but the point was, it wasn't like everybody at that point had really gone mad. We were saying people had gone mad purchasing and so on, and we knew there were crowds and so on. But as you say, it's not as bad as saying you've got 24 hours to fill your larder. I would point out actually that our house always has lots of supplies just in case there is a nuclear war.
Always be prepared. Just one final comment rather than the questions, and see whether you would like to comment on as well. So one of our attendees have said, we also need to take account of decision makers' risk appetite when determining what constitutes an emergency, which is ultimately up to the courts. I think as professionals, we tend to be more risk averse than perhaps the decision makers. We need to properly inform them about the risks and accept when it is someone else's decision.
Interesting. So remember, there are three, like Princess Diana said, there are three people in this relationship. Okay, Chris, you probably don't know what I'm talking about. But anyway, there are three lots of people in this situation. You've got the government, you've got the medical experts in the case of a pandemic, and you've got the procurement professionals. And also, not to be forgotten, you've got the suppliers. Each of them is going to have a different risk appetite, and each of them needs to be sitting cobra-like in the same room to understand, and I agree with the point, to understand the risks and what everybody is thinking, and to try and take a view. Because everyone needs to understand what the circumstances and what the results are of not taking a particular action, not declaring an emergency. And I use the term declaring because in lots of countries, they will literally declare an emergency. That would happen in the UK. It hasn't happened with the pandemic. So you need to get everybody in that same room and to understand and to go through each of the scenarios. If you don't have everybody's viewpoint, all the stakeholders involved, then you can bet your life that the problem that arises will be from that one group of stakeholders that you didn't invite into the room. You'll make a decision, you won't have understood their perspective, and guess what? They will suffer. We've seen that actually during the pandemic, because the government each week has had to face a different issue. The latest one obviously is students in lockdown. And, you've got university students sitting in their halls of residence and not being able to leave the hall of residence. And then people suddenly went, oh, hang on a minute, how are they going to get food? Yeah. Now, maybe having a student in the room when they were making those decisions would have helped to understand the perspective from the student as well. So those different risk appetites, yes, of course, we need to understand them all, and there will be friction between those different groups. But at the end of the day, it's the government who make the final decision, and therefore they need to be given the advice. They can only make a proper decision if they get the proper advice.
Thank you very much, Maurice. Just mindful of the time, we only got another 5 minutes left. So I'm going to just do a quick wrap up. And if people have any more thoughts or questions, please feel free to email me, and I will send the recording of this webinar to those who cannot attend this webinar later on to either tomorrow or Monday. Maurice, can you move to the next slide, please?
Of course. I said, of course, and then nothing happened.
Here we go. Yeah, well, thank you very much for everyone attending. As I know some of you follow our webinars nearly on a weekly basis. Thank you very much. For those who's first time joining us, we do run this webinar not around weekly basis. So do sign up to our training alerts so we can keep you informed of all our upcoming webinars. Next week, we'll be running a webinar on mental health, and this is to raising awareness for World Mental Health Day. So we will have a Dr. Ajay Kanawal with us, and he will be talking about anxiety. So if you're interested, go to our website, and on the webinar page, you can sign up to our webinars there. Can I have the next slide, please, Maurice? Yep, finally, we are on nearly all social media platforms, from Instagram to YouTube. So follow us, connect with us, and most important of all, I think in this pandemic, as the number of cases increasing, everyone please stay well and stay safe, and don't forget, stay connected. Follow us on our social media, and we will try to release as much learning opportunities, learning materials with everyone as much as possible. So, yep, stay connected. And once again, thank you very much, Maurice, for giving us 1 hour this morning, sharing your thoughts and giving us some insights into the best practices that we have seen during this pandemic. Thank you so much, and stay safe, stay connected, everyone.